Here to discuss a preventable cancer, please welcome Dr. Marcia Posner, Director of Head and Neck Medical Oncology at Mount Sinai's Tisch Cancer Institute, and Marcia Cross, actor, HPV educator, and anal cancer thriver. Welcome back, Alison Stewart.
I have to get my questions in because those two know each other and we'll start talking. So Marcia, you have this incredibly successful career. You go on the journey to become a mom. Everything's going great. You do the right thing. You go to get your annual gynecological exam. Mm-hmm. Can you tell our audience what happened during that exam?
Well, let's see. I was just kind of yakking away, and I've known my gynecologist for a long time. And she's an incredibly wonderful doctor, although she just retired. And at the end of the exam, she did a digital rectal exam, which I highly recommend for everyone. And she didn't like something she felt, and she left the room, made another appointment with a doctor down the street. I still was thinking nothing about it. I was actually kind of annoyed that I was going to miss my daughter's basketball game, but I went. I knew we didn't have much time, and I feel like there's so much to cover. So, I went to the next doctor, and she gave me an exam, and she came around the table, and she said, well, I just want you to know that whatever it is, it's curable. And I immediately left my body. Mm-hmm. And that's where it all began.
What did you think when you first heard from a doctor, Marcia, you have anal cancer?
It still sounds crazy. I was shocked, I guess. Yeah, just completely shocked. It wasn't that quick for it to sink in. Mm-hmm. It took me a long time because I was waiting for the biopsy. Was it in fact positive? Did I actually have cancer? So it took a long time before the penny dropped, and I was like, oh, okay, I guess this is real.
What questions did you have? And where did you go for answers?
I had a lot of questions, and I went on the internet. I used Dr. Google a lot, and I learned pretty much everything I needed to know from that. And what I was mostly concerned about were side effects, and people that were writing on the internet were really open and honest about that, whereas when I went to the doctor, it was kind of downplayed. So I was glad that I had that information.
How did people react? How did you decide you wanted to tell people about your cancer?
You know, I just want to say something to Dr. Posner. Is that okay?
He's coming next.
Oh, he is? Okay,
yeah,
I'm so conscious of, you know. Well, at first, my concern was not to worry my parents. And so I didn't want to tell them until I was through it. And then as I was going through it and read everything I did, and what I found out was that people with anal cancer were mostly dealing with gobs of shame, lying about it, and then learned everything I did about HPV. I thought, oh dear, I can't not help. Mm-hmm. So I thought, well, I'll do this People magazine article, and that will help. And it did help a little, but there's still so much more. And so I kind of got dragged into this because, well, as you'll get to, my husband had throat cancer, and you know, a decade later I had anal cancer, and so here I am thrown into this maelstrom of the HPV world.
Dr. Posner, can you explain to folks how you know Marcia?
Pardon me?
Can you explain how you know Marcia when you first met?
Oh, we met about 10 years ago when her husband had oropharynx cancer and came to see me in Boston, where I was in charge of the head and neck program at Dana-Farber Cancer Institute. And we devised a treatment plan for him that he was able to receive in Los Angeles with some physicians I knew who were very capable and thoughtful. And he underwent a course of therapy and was cured.
Yes.
This is an odd question, but doctor, what is the most misguided question you've been asked about HPV that lets you know that people don't understand?
Somebody once asked me if being licked by their dog could transmit the virus. That was one of them.
Why don't people know more about it?
Well, I think first it is the disease that causes, the virus that causes cervical cancer, anal cancer, penile cancer, and tonsillar base of tongue cancer. These are wet areas in the body, and the virus doesn't spread through the bloodstream. It's really spread through secretions. And people don't really know much about it because it involves primarily genital areas initially. And there's, as Marcia said, there's a lot of shame involved. And when you think that this is a disease that's transmitted by physical contact between people, and that's often intimate contact, then there is a shadow of shame that's involved. The good news is that there is a vaccine that can prevent getting the virus. And the bad news is that everybody's infected with it by the time they're in their 20s. You don't have to have actual sexual contact to transmit the virus. It's transmitted by saliva, by secretions, by kissing, by saliva on your hands if you touch your body in any way, which we all normally do every day. So it's really, there are specific populations that have a very high risk of developing it because of the immunosuppression that associates their diseases. So people with AIDS, for example, have a high rate of cervical cancer among women and anal cancer among men because of the immunosuppression. But generally, we don't know why people actually get the virus, get the cancer in those people who aren't immunosuppressed. It's, at this point, still a mystery, and 80 to 85% of the people that get it don't have some other underlying root cause. They're just normal people who have a normal life and have normal intimate relationships, and this is what they get.
From your experience, what is something that the medical community could do to help people know more about HPV? What is something that communities could do, schools could do?
Well, I'm not an expert in that, but I can tell you that what we have at Mount Sinai is a great pediatrics program, and we've reached out and have the highest vaccination rate in young women in East and Central Harlem, and that's all because there's a real interest in a program to do this. The highest vaccination rate, higher than the vaccination rate in the United States or in New York City. And in fact, I think the schools should have programs in this and should advocate for it. This is a very safe vaccine that has no side effects that I'm aware of. In the randomized trials that were done, all the side effects were equally shown in the placebo group. So much of the nonsense about people fainting or having other side effects is very, very misguided. This is a great vaccine, and it'll eliminate this disease in 30 years.
I'd like to just jump in and say that, while that may be true, there are generations, my generation, maybe the generation, I'm in my late 50s, the generation before me, maybe one or two, and the generations don't know about HPV. And the reason that's a problem in my eyes is that HPV is on the rise with postmenopausal women, and that's precisely when they're backing off from pap smears. A friend of mine who's 62, no new sexual contact, by the way, either. This is something, a virus that can lay dormant in your body. You have no idea. She'd never had it, an abnormal pap smear. And so I think we need to educate that population that they need to get digital rectal exams and take any symptoms very seriously if they think they have a hemorrhoid, or with men if they think they have a lump on their throat. Maybe educate dentists, have a plan in place with all gynecologists that they all do digital rectal exams, because we kind of have this thing of like, whose department is it? So I feel like there's a lot of education. I mean, there's a lot of emphasis given on the vaccine, but I also feel like we have to look at the older population and make sure that they don't fall through the cracks. Pardon the pun.
Doctor.
Just came out.
Doctor, how do you counter the unfortunate hordes of anti-vaxxers? People say, I would never give my 11 or 12-year-old daughter a vaccine, especially not this vaccine. How do we counter anti-vaxxers in this culture?
I have no way to tell people who have a fixed idea that's immutable in their minds that's just plain crazy. You know, it's no different than having polio vaccination workers being shot in Pakistan because there's some mistaken belief that that leads to sterilization. Many of these vaccines have changed the world. I mean, my stepfather had polio and almost died. When I was in training, I saw a young man that was in the last iron lung in Massachusetts in a chronic care hospital. So these are terrible diseases that have been virtually wiped out because of vaccination, and yet we have crazy people running around thinking that vaccines are terrible, and they're not. They save lives. Do some people have side effects? Some of the live vaccines do cause side effects. Kids have fevers. Sometimes they'll have a seizure from a fever. Sometimes there'll be more significant problems related to that. But the notion that they cause autism has completely been debunked. It's a lie spread by people who have whatever craziness they have in their lives to spread that and to have a following. It's crazy and it's nuts. And I think it's very important that people understand. I mean, hepatitis B is going to be wiped out because we have a hepatitis B vaccine. And it would be great if we had a hep C vaccine. And we have an HPV vaccine. This is a disease that I don't have to treat in 30 years if I'm still here, and if people get vaccinated. And that's important. I think it's an important part of education. I think it's a responsibility of the schools to address this, and I think it's a responsibility of the society to insist that if you have a transmissible disease risk because you're not vaccinated, that you understand that that is a risk for everybody else. The consequences to everybody else when you're not vaccinated or your child is not vaccinated is severe, and that's important to know. Sorry.
I think I know the answer to this, Marcia. You are going to have your girls vaccinated, or have you?
They've had their first shot, yes.
Never had a doubt about it. You never had a doubt that that would happen.
That they would have their... No, I would say that I went through a lot of stages with it, that even though I'm of sane mind, I'm also a mother, and that the internet is ripe with, terrifying stories. So I would say I definitely grappled with some fear about it. Mm-hmm. I think it's easy to have two minds, the scientific mind and also the mother mind, and I think you need to have a lot of compassion with parents going through the process. I mean, you should be how you are, but there also needs to be a little empathy in the process of there's fear. Fear has been instilled, and we have to deal with it.
I'm going to ask people, if you want to ask questions, to go to Slido. I'm going to ask a few more here. So, Marcia, you have a really big internet social media following. You have, I checked this morning, 266,000 followers on Twitter, 181,000 followers on Instagram. You were very transparent and open about your treatment. Why did you choose to go that route and let everybody know what was happening?
If I had had breast cancer, you would never have heard from me because it's not really, I just would have moved on with my life because there's plenty of people talking about it. But I found myself in a position where nobody wants this job, nobody wants to come forward, and I knew that people were suffering and people were ashamed. And then in addition to that, I educated myself. I had to. Like my husband, myself, it was about the HPV virus, and I realized there's a huge void and a lack of knowledge and education. So that is the only reason I'm here, because I don't know, it's not my dream job. I mean, I'm happy to be here, but sit around and talk about anal cancer, and that is not it's not glamorous.
She said something so funny to me backstage. She said, I just would like a shallow job. That's all I want to do. Let's take a question. Are there any updates on HPV vaccine booster for patients vaccinated when young? We are seeing patients that were vaccinated showing up with cervical cancer. From Dr. Smith.
Yeah, there is some slippage, I think. This is a vaccine that hasn't been around for 2 or 3 decades, so we don't know if you need a revaccination the same way you do with, for example, chickenpox, which causes shingles. So I think that we're going to find that we're going to need that, and I think that's going to be part of what the CDC and the vaccine companies are going to have to look at. There has been a recent increase in the age that it's approved for, so if you're 45 or younger, you can get the vaccine, which is great. And I think it does, even though we're all infected, I think it does prevent the risk. There's some data in the early vaccine studies that women who had HPV positive cervical smears, HPV-16, which is the high-risk variant, actually had a less risk of developing a form of aggressive HPV if they had the vaccine on the study. So I think there's evidence that if you have a spouse or if you have feel that you're at risk, that it's something you could do. And I think even up through 70, we're seeing a lot of men in their 70s with oropharynx cancer caused by HPV today. So this whole group of people that were in their 40s and 50s that were at risk 20 years ago are now in their 70s and are at risk again, so and continue to be.
Another question, could you discuss the vaccination of young men and the idea that this vaccine is for, quote, girls only?
This is a vaccine for men and women. The oropharynx cancer form of the disease is more common in men 3 to 1 compared to women. And I would say in my experience it's probably a little bit greater in men than that. So there's a high risk, and I think also when men are vaccinated they also protect women. It's part of the herd experience. You're really having 50% of the population being unvaccinated, and I think that's not a good idea.
Is there an age when the vaccine no longer makes sense to get?
I frankly think not. I think it's reasonable to get it up through your 70s, and I have to admit that I haven't gotten it. But I'm part of a cohort study looking at people who might be at risk for getting it, and so I'm undergoing experimental testing as part of that. So I'm being watched.
Marcia, this is for you. What was really helpful in your cancer journey? What was really unhelpful?
I was very blessed in that I have great friends and obviously a wonderful family, and that was everything to me. So I say, you know, the heck with Facebook and Instagram if you really want to have real friends, because that's what got me through it. Was I had really round-the-clock care and love by a wonderful group of women, and you know, my husband really went to bat and took care of the kids. So I had an amazing amount of support, and I think that's the most important thing. At least it was for me, and of course, great care. But
what was something unhelpful that happened during your journey that you would not want to have happen to someone else?
I think what's really hard, and I spoke to Dr. Posner about this, is that the way medicine is right now, it's like we're body parts. So the radiologist does this, and the next person does that, and there's no holistic system in place. So the doctors kind of look at you like a body part. And I was saying, like, I asked about a symptom, and the doctor had no idea what I was talking about, and it terrified me. I was like, I don't want to out this person, because I understand now that it's not just that person, it happens system. Everywhere. So something that they really should have known if they'd spent a little time on, what the ramifications of their job was, that was terrifying. I looked at my friend in the room, because we both knew about this simple thing, and the doctor said, I don't know what you're talking about. And that was frightening. So I think that it's part of a bigger problem. We really need to have a more holistic system, more integrated, be less looked at as body parts, and hopefully that's coming. I think it's coming. So,
did you want to add something before we wrap?
Yeah, I agree. The program that we're in, I'm a medical oncologist. I work with radiation oncologists and surgical oncologists, and we meet together and have a multidisciplinary management of the patient so that everybody gets the benefit of all three of these disciplines, and we have social workers and nutritionists involved in the care. So and I have the luxury of doing this in an academic center, which supports this center of excellence concept. But there are many places where the perspective stops at the door of the physician, and they don't really think about the consequences elsewhere. So part of this is empathy and having compassion for the patient and really connecting with them. And part of it is really trying to understand the complete picture of what we as physicians are doing to our patients and what they're going through. So it's a lot of hand-holding, talking, and helping. And, again, doing everything we can for those things we can do things for, and supporting where we can't.
And also, and I think since we've talked a lot about, survivorship, that looking at the long-term effects of whatever treatment that you've gotten, and not just like, oh, you're cured or whatever, and you walk out the door, because, my husband, 10 years later, he's going to go and he has to have his throat stretched out because the radiation causes constriction. Yep. And did his doctors tell him that? No. I had people on Instagram write to me and say, make sure his carotid artery is not being smothered because my husband had throat cancer and he passed out. And these are all true things, so thank you to all those people. But the doctors aren't talking about it, at least his doctors that I know of. I could be wrong and he didn't tell me, but you know, it's kind of like it stops at the door of that rather than, okay, let's continue to watch this as you go down, you know, through your life, which is a great thing.
You have cancer and you have the rest of your life well to live. You're well? Everything's good with you?
Fabulous.
Good to hear.
Thank you.
Marcia Cross, Dr. Posner, thank you so much.